For those of you that didn't get up at the end of it. The senile vagina. So Dr. Vonda Wright, first of all, thank you for the invitation. I will fly across the country for you once a year, every year, until the ovaries fall out of the vagina. So she looked through, we're talking, what should we talk about, blah, blah, and she says, I want you to scare them a little bit. And in medical conferences, we don't have the liberty of being a little bit dramatic with our presentations. It's kind of a tight, buttoned-up group. So when I get an audience where I actually get to tell you, this is a big effing deal, it's gonna be fun. But so we're gonna scare you a little bit, but then we're gonna bring you back up. So we won't keep you low, I promise. So raise your hand if you've heard the term genital urinary syndrome of menopause. I know, this is a very educated group. It's a mouthful, it's GSM for short. And actually a urologist sitting in a room of a bunch of gynecologists helped put the urinary in that term, because before then it was called atrophic vagina. And atrophic vagina doesn't really describe all the things that happen everywhere else in the pelvis. Remember, we have estrogen and testosterone receptors everywhere in our body. So when those hormones go down, we have profound changes everywhere. One of them is the pelvis. So if you just call it senile vagina, or then you call it atrophic vagina, you're not really understanding everything that's going on. And this kind of sounds like a personality flaw more than a medical diagnosis. The reason I found senile vagina, this is in medical literature in 1985. I took this from a journal, senile vagina. And in that, so the publication in 1985 was the paper that everybody says use it or lose it comes from. And so I have a podcast, I have an episode, it's an old episode now, it's called Stop Gaslighting All Over My Vagina. Because one way to get women to buy products and to do things is to say use it or lose it, which is very true for heart health and for muscles and for bones. It's very, very true. But putting a penis in your vagina does not prevent hormone changes. So I dug back to find the study, and just for the nerds in the room, gynecology office took a bunch of women who were sexually active, took a bunch of women who weren't sexually active. They did pelvic exams on them. The non-sexually active women had more atrophy. They didn't even say it was a use it or lose it. It was a correlation study, right? Of course they're less sexually active. So there is a study, and they wrongly took that to should all over your sex life and should all over your vagina. So we're going to talk about atrophic vaginitis. So what happens is hormones function by keeping our body working well. They work on the cell receptors, they go in, they affect the cell nucleus, and they affect the mitochondria. They affect many, many things that keep things functioning well. And your vagina and your vulva are no different. Our body evolved to have all this estrogen, and I get into this feisty conversation of like, but why do we not replace our ovary when we replace you got glasses on, you outlived your eyes, right? You outlived your hip, you outlived your teeth, you outlived your ear. We fix all of that. Why do we not fix the ovary just because you can't see it, right? It's there. And the thing is, it's not that like the ovary didn't decide to live as long as us. That's not the abnormal thing. The abnormal thing is that we're living so freaking long. We've never lived this long on a global scale ever before as a population. I would say we're just trying to figure it out how to do it well. Because we're watching the older generation and we're like, that can't be the way. Our generation is to figure out how to do this well. It's not the ovary's fault that we have clean water, consistent food supplies, antibiotics, all these amazing things that have actually made us outlive many of our organs. So for those who want to know, that's a vagina. And you can see it, the healthy estrogen, it's nice and it's wrinkly, it's stretchy, it's elastic. Babies can go through through there, vibrators can go in there, tampons can go in there. Like, it's very flexible organ, and it gets thin, it gets rigid. The pH changes, your microbiome changes because of your drop in hormones. And microbiome was poo-poo just a couple of years ago, and now it's the hottest thing in medicine. Microbiome matters. Otherwise, you die more. And so this talk is going to be all about the ways that you can die. Because it's very dramatic. The true death, and where you can actually truly die, is a urinary tract infection. Especially when you're older and you're more frail, and we've overused our antibiotics, and you get a drug-resistant bacteria, and it takes you down. And many, many people tell me stories about, my mom would have been here if. It's a real concern. It is not, our heart disease is still, why does nobody care about heart disease? It blows my mind, it's the #1 killer. That's what we should all be focusing on. This is absolutely devastating. And urinary tract infections are common. It's one of the top 8 reasons women go to physicians is a urinary tract infection. And women come to me and they're like, what do I do next time I get one? And I'm like, why are we thinking like that? Why don't we think, how can I prevent the next one? That's the better conversation, but it tells me women think it's inevitable. And then I check, the only person to not ever have a risk of a UTI is a dead person. Like we're living things and bacteria find their ways, but we can decrease the risk by 50 to 60% by just replacing the hormones that we have. So this is our true death, urinary tract infections. And the other thing is not just getting a UTI and dying, but it's getting a UTI and falling. That also puts you into the nursing home. That also then breaks the hip. It's the trigger that keeps happening. I saw it this week, you get the UTI, then you get the C. diff from the antibiotics, right? So it's not dramatic, no, 2.77 per 100, that's not that bad, but it's all the fallout and the expense that it is to have a urinary tract infection. Number 2 death, clitoral death. So we have an organ that its only job is pleasure, and we carry it around with us 24 hours a day. Penis also has pleasure, but it also has to pee and get sperm out. It has 3 jobs. The clitoris has 1 job, it's pleasure. The clitoris loses its blood flow when our testosterone and estrogen goes down. Amazing study, giving women testosterone and actually ultrasounding their clitoral artery, watching it dilate. Very, very interesting, testosterone and estrogen, the role of the clitoris. Clitoris research is not as common as penis research. There's a lot of penis research, but things we know about, they're the same organ. We all started out with one pluripotent anatomical thing, and it went one way or the other. But the other very interesting thing about arousal and sexual dysfunction in general is that we know erectile dysfunction precedes a heart attack in a man by 3 to 5 years. Where is that data on women? We don't have it, but I'm telling you it's the exact same organ. We've got to be paying attention to it. So when your hormones go down, you can get phimosis, which I learned this week is Greek for to muzzle. So the skin above the clitoris will come over like a big turtleneck, and then it won't go back. And women will say, I feel like I'm kind of trying to have an orgasm through an Afghan. Extra there, it takes a lot longer. So clitoral death, not all completely reversible by putting the hormones back, but I would argue, why do I wait for you to be broken to try to fix you? Why do you wait to not know where your clitoris is before you start realizing hormones are important? Deadly outcome number 3, bladder death. It doesn't actually die, but you might think it is when you're getting up 4 times a night to pee, right? So the trigone of the bladder, that's the name for the muscle of the bladder, incredibly hormone sensitive. Estrogen helps the bladder muscle function well. And remember, babies, they wear diapers, right? Because the bladder has to keep you safe, it has to get rid of the urine, it just kind of goes on an automatic thing. And then you learn what's socially acceptable and that there's only certain times to pee, and you train it. When you take the hormones away, it starts defaulting back to that kind of intrinsic nervous system that it was programmed with. So now it wants to pee when it wants to pee again, instead of the boss lady, right? So replacing vaginal estrogen, and I'm a urologist. A lot of urologists don't even know this. That vaginal estrogen in the studies is equivalent to overactive bladder medications. Overactive bladder medications, except for some newer expensive ones, are actually contraindicated in women over the age of 65. There's a correlation with dementia. So So my argument is vaginal estrogen and pelvic floor physical therapy. To any PTs here, I know, where are you? Yes, we can't do our job without you, thank you. That's first-line therapy, not nasty medications that affect your brain. And the outcome number 4, sex death. So why do people stop having sex? There's many, many reasons. But genital urinary syndrome of menopause is a huge reason. And I see women, frequently they'll be like, oh, I stopped having sex 6 years ago, 7 years ago, 8 years ago. Why are my UTIs, why are you telling me this is menopause? And what that tells me is the branding of menopause, the education is so poor. People think it's a hot flash and an end of periods, and then you're over it. It's the gift that keeps on giving in terms of our body continues to be affected by the lack of hormones for the rest of your life. So genital urinary syndrome of menopause, for you, might not kick in until 7 years after. Kick in meaning you actually have symptoms, right? But we know that between 50 and 80% of women will suffer from GSM in their life. So it's almost inevitable that the pelvis will have changes if you live long enough. Now, how come that small minority of women don't have symptoms or don't have changes? We don't know. There's some research that's happening. But basically for everybody else, it is inevitable. Sex needs to be comfortable in order for you to desire it. You can't desire mushy broccoli, and you don't desire hitting your thumb with a hammer. Some people desire a little pain with sex, but that's fine. Someone will come to see me and they'll say, I have 2 problems. I love taking problems away from women. I have 2 problems. I have pain with sex and I have low desire. And I'm like, good news, you have 1 problem. We have to fix the pain with sex. Where's my physical therapist at? They help people with pain with sex and they love doing it, and they know that vaginal estrogen is absolutely also important. Because when the skin gets dry, it hurts and it gets tight so it doesn't get elastic. And then the muscles, because they're smart, they say, I need to protect this area. So I'm gonna get tight. And I'm not gonna let her put anything down there without causing her pain because I need her to know that it hurts down here. Right, so now we got muscle dysfunction on top of skin dysfunction. That's why I need my physical therapist to help these women as well. So very, very common. And for women who are partnered with men, where are my men at? I don't want to push you. Men care a lot. Yes. Men care a lot about this. They don't always know what's going on. But they care a lot, and not just because they get more sex, but that's reason 1, 2, and 3. But reason 4 is because they love us. Reason 5 is they don't want to see anybody in pain, right? So they really care too, and the studies show that. Men are like, what can we do? I want to help, and they want to be involved and know about this. So thank you for showing up. I love it when women show up. Deadly outcome number 5, partnership death. So I gave my very first retreat in Sedona last year, and it was amazing, and not just doctors showed up. I had a pilot there, and an amazing divorce lawyer come. And she was a badass. Like, if she was in a room with you, she better be on your team, or you're in trouble. Sort of divorce lawyer. And she's like, I'm here to learn everything I can about hormones and pelvic health and GSM because I am fully convinced that the large majority of what she calls gray divorces, so middle-aged, kids are gone, are because of lack of intimacy and lack of sex. And she's like, I think a tube of vaginal estrogen saves relationships. And I don't think she's wrong. I mean, she's been listening to women talk for years and years and years. And so that was what really got me interested in, like, what's the role of sex in keeping intimacy together, in keeping bonding together, in keeping marriages together. And it is very, very hard to find data on this, my friends, because people don't go to the judge and say, I'm divorcing them because of sex. It's the reason, but it's under. So on Google, they're saying maybe about a third to a half of divorces happen because of lack of sex and intimacy. And I always want to be very careful. I never want to say, use it or lose it. Like, this is a partnership, this is a discussion, and many, like the divorce lawyer will tell you, there are many, many, many little paper cuts that happen before they get into her office. So it's not just that you can't hold something in your vagina. But we stop being intimate. We now have separate bedrooms. We now can't even talk. It escalates. And her belief is, let's keep the communication open. Adult sex ed 101 is just, can we talk about this topic, right? But also keeping things functioning. 6 months after Viagra got FDA approved in 1998, there were 5.3 million prescriptions already written. They want to take care of their body, right? Why don't we take care of ours? And for me as a urologist, because our job is to make penises hard, welcome. As I started noticing who's taking care of the people who are supposed to be sleeping with the people that we're giving Viagra to. Right? And I guarantee you a lot of urologists were not thinking this holistically about the penis in front of them. And then papers started to be published where you destabilize a relationship when you bring the Viagra in. Because you've treated one person's sexual dysfunction, you have not treated the partnership's sexual dysfunction. And so we're starting to see clinics that care about couples' sexual health instead of just one. So for better or for worse, when a man comes and sees me for his ED now, I'm like, so what's your plan? I walk out of here with a super dick? What are we gonna do? 9 times out of 10, they haven't thought about it. And I was like, okay, well maybe it's just you, Joe. But Mike hadn't thought about it either, and Matt hadn't thought about it either. And I'm like, do you tell your female partner that you're coming to the doctor for Viagra? They're like, no. I'm like, how long has it been since you put this penis in her vagina? And they're like, 8 years. And I'm like, what's the plan tonight? He's like, I don't know. And so, it makes for very good stand-up humor, it truly does, but it tells me we need to appreciate everybody's sexual health, not just one half of a relationship, if we want everybody to be successful. So, partnership death, deadly outcome number 5. So, my good friend, Dr. Rachel Rubin, this is her paper. So basically they said, how much does recurrent urinary tract infections cost? Specifically, how much does it cost the Medicare population? Right, that's the highest risk. And what would happen if we mailed all the Medicare people a tube of vaginal estrogen? So you gave vaginal estrogen to every Medicare recipient with a vagina, and they used it. Because it doesn't work if it just sits in your medicine cabinet. You would save Medicare multiple billions of dollars yearly. So that's a big money argument, because money talks. That's a big money argument for how well. And getting buy-in for women, I say, if I had something that decreased your risk of urinary tract infection by 50 to 60%, would you be interested in that? And they're like, yeah. And I'm like, that's how I get buy-in. I don't tell them they should use vaginal estrogen. I say, would you like something that decreases this by over half? They're like, yeah. It's vaginal estrogen. It's the best essential oil that there is. So my argument is, why do I need to wait for you to suffer to then try to find a doctor who actually knows what this is and that there's cheap, solvable things available? Why do I wait for you to suffer? Why can't I say, listen, you're 55, here's your colonoscopy, your mammogram, and your vaginal estrogen? And traditional healthcare is very bad at preventing. We're great at treating disease, There's not enough doctors and you're suffering way too long. 7 years is way too long for you to come in, and then maybe if you're lucky, they know, people know about vaginal estrogen. It's been around since the 60s and it's over the counter in multiple countries. So we can talk about it later, but there's many different brands, there's many different types, everybody can have a ride. And it's really good stuff. The cream, I have a cream bias because I like the cream for the crow's feet underneath the eyes. But you can also put it on the clitoris and get it on the labia. That's 6 o'clock, if I can be a vulva for one hot second. This is the bottom half of the entrance of a vulva, my friends. That 6 o'clock area, notoriously thin, dry, tight, really ouchy with sex. That is a classic perimenopause, menopause symptom. So, hopefully I brought you down and then I brought you back up. Thank you for coming. We have a couple of minutes for some questions. And I'll let you say it and then I'll repeat it. But yes, the stripes because they're beautiful.
I'm a pharmacist, so I don't know if it's urban legend, but I think it's a good question that you can answer. The man who ended up with feminization symptoms because of being exposed to vaginal estrogen.
Very good question. Okay, so the question is, if you are sexually active with a penis owner, and you put in your vaginal estrogen cream that night because it's nice to put it in right before you go to bed because then it's not goopy and you just get up in the morning and clean it off and it's fine. But maybe you guys got in the mood after you did that. Does it mean that your hand's off because you put your vaginal estrogen cream in your vagina? Very good question. So they've done studies because who do we care about? The men. So we put some estrogen cream on their penis and then we measured their estrogen levels afterwards. Remember, men have estrogen in their bodies. They actually have more estrogen in their bodies than postmenopausal women. And estrogen in their bodies is responsible for some of their sexual desire. That's what estrogen does. Right? So normalize hormones in every body. Very cool study just for the men. They took men's testosterone, they got rid of it, then they gave them back the testosterone, blocked the conversion to estrogen, their sex drive went down. New England Journal of Medicine article, it's very cool. So, put estrogen cream on the penis, check the man's estradiol levels. The estradiol levels does go up, but not above what's normal for men. And then it goes back down within 8 hours. So to me, this is what I tell women. I say, don't use estrogen cream as a sexual lubricant. But it's okay if it gets on a penis every now and again. It's going to be absolutely fine. No, feminizing? No. You need like oral doses of estrogen to feminize a man. So yeah, I would say no as far as that goes. Fantastic question. Yes, ma'am, back there.
I'm in the process of having to have a hysterectomy because I have a fibroid. And they're saying that they're going to cut through the vagina to take it out. Would I be someone who should consider that as a kind of like to help heal and treat? Because I'm sorry, I have a good sex life and I don't want to give it.
Yeah, so the question is vaginal estrogen post-surgery of the uterus or vagina. For the first couple of weeks, just take a break because you need to heal and you got stitches. But after that, yeah, absolutely, because I think it's preventative medicine. And if you're going to put low hormones on top of surgical scars, that's 2 reasons for the vagina to get tight. And vaginal estrogen will help with both of those. Let's see if we can do one more question. She's not standing up yet. Can I do one more? Yeah, she's going to listen to one more. In the red.
What about vaginal estrogen for breast cancer survivors?
Excellent question. Breast cancer survivors, can you use vaginal estrogen? An overwhelming yes. The American College of Obstetrics and Gynecology has a position statement online. You can get it for free. You can print it out. You can bring it to your oncologist. Here's the deal. Vaginal estrogen is skincare. It's skincare for down there. They've done studies. They gave you vaginal estrogen. They checked your blood levels. Small spike, still postmenopausal spike. Spike as you're absorbing it, because in the beginning you have very thin tissues because it's probably been 5 years and you weren't on it preventatively. So you will absorb a little bit of it in the beginning, pretty common. And then it gets better as your skin actually turns into skin that doesn't just suck everything up because it's now actually healthy and has that thick barrier we looked at. Right? So you get a little absorption in the beginning and then it mellows out. You can be it's the very, very rare breast cancer patient is undergoing current treatment, and they would say no, very rare. But certainly all my survivors. And you've got physician statements to back you up. This stuff has been around for decades. We've studied it for a long time. The other myth about vaginal estrogen is you can't be on it until you're done with your periods. Not true. Perimenopause, breastfeeding, also a big low estrogen state. So lots and lots of other reasons to be on it. Yes?
If you're on HRT, bioidentical, do you still need to use estrogen vaginally?
Yeah, good question. So the question is, if you're on systemic hormones, can you be on vaginal? And the data shows about 30 to 50% of women will be on both. Remember, somebody ran into me and they're like, you need to do a study to prove that. And I'm like, okay, so systemic estrogen level plus something that doesn't raise systemic estrogen level equals systemic estrogen level, right? That's all the math you need. Vaginal estrogen skincare, it's not absorptive, it does not. A year's worth of vaginal estrogen is equivalent to 1 oral pill of 1 milligram oral estradiol. It's negligible. And it's over the counter in many countries. That's all I got.